Hi everybody, happy to see you once more again. Today is World Heart Day. We are happy and we are thanking God Almighty for giving us such an organ that helps us to function and circulate the blood. Please, a quick disclaimer: I am not a cardiologist. I am a registered nurse and a paramedic. So I am not a cardiologist. Please, what the video I'm doing is just to create awareness, public awareness for people. Okay, thank you. I'm going to use a layman's language so that everybody will understand it. I am not going to bore you guys with these heavy medical terms that will make you not to understand. I want to bring it down to a layman's understanding so that all of us, both the middle, educated, non-educated, everybody will understand what I'm saying today. So today is the day that the whole world have set aside for us to look into our health, more especially our heart. Today is World Heart Day. This is what today is. 29th of September of every year is the World Heart Day. And in this World Heart Day today, we are thanking God Almighty for such a gift that He gave to us. What I want us to talk about is that I think our heart is one of the most important organ in the body, because if we don't have a heart, you are like a car without an engine. The engine of the car do the whole work of pumping and everything to the system of the car that makes a car to move. Likewise, our heart makes the body system to work, to function. Now, a lot of us are not taking care of this particular beautiful organ that God gave to us. This is why the whole world have set aside today, 29th of September of every year, should be the World Heart Day. Now, in this our heart, if few people can believe me, both here in Israel, both back home in Nigeria, for some of you that know that I'm from Nigeria, a lot of people are having cardiovascular issue. Cardiovascular, forget about the term, it's just in simple terms meaning heart problems. A lot of people are suffering heart problems that some of them do not even know, and this is why we are having a lot of cardiac arrest, which is sudden stop of the heart. Suddenly the heart will stop pumping. I'm telling you, I'm going to use a layman's language because I want everybody to understand it. Suddenly the heart will stop pumping, will stop working, and this is when we say that the person have cardiac arrest. So, and it's not only cardiac arrest is the only problem that affects our heart. A lot of problems affect our heart. Cardiovascular system is very big to the extent that there's a lot of health conditions that affect our heart. But today I'm going to talk about this heart attack that is happening everywhere. Like, it's become so normal. Within a short period, less than 6 months, I have lost almost 3 or 4 people very dear to me to heart attack. In a layman language, what does heart attack means? Our heart is a whole organ that has some branches. I'll be putting it by this way, upside. You can see it here. The one up here is what is called the aorta. This is the system of the heart, and this is the aorta. Aorta pumps the blood internally of the heart, and there is this particular heart that is an organ need another blood vessels, small pipe in which the blood pass through to maintain that body that of the heart. A heart has a muscle. A heart has a muscle. What maintains the muscles of the heart is these small blood veins, these blood arteries that circulate all over that move around like electric wire all over the heart muscles. And these muscles, these blood vessels, is the one that is bringing about blood circulation. The blood move all around the muscles and maintain the muscle so that the muscle will keep on pumping in, out of the blood, taking out used blood, bringing it back inside the body with oxygen. This is the function of it with the help of your lungs. Now, if this organ, if these particular blood vessels that are supplying blood to these muscles, maybe something happened that it makes it not to pump blood. Maybe there is a little blockage from the arteries, which we call, which can be caused by with the cholesterol. When you have high level of cholesterol, this is why we always tell people, please go and check your cholesterol level to know if it is high. If it is high, you have to do something. If not, when the cholesterol level became so high, it can bring what is called occlusion. Occlusion is simple blockage. It will bring blockage in these small blood vessels you are seeing here that is supplying blood to these muscles of the heart that make it to pump. When there is shortage, when there's blockage of blood to this particular muscle, it will develop what is called ischemia. Ischemia means shortage of cutout of blood to this particular muscles you are seeing. And when it happens, what will happen? The blood supply to these particular muscles will stop, and the muscles will not be able to get blood. It will start dying off. And when it collapses and when it goes down, the only thing that will happen is that the muscle cannot be able to contract again. It cannot be able to push blood again. You understand me? Now, this is when they are going to say that the person have a transit. Okay, now I think I have explained it. I think I have explained what is heart attack. Now, I am talking about what is the causes of this heart attack. What brings about this heart attack? What brings about it is not only when the blood supply is cut off. Something like when somebody have what is called when somebody have have some health conditions like the blockage. I'm telling you, I'm going to use a lemon. I tell you, so the thing that causes it is not only when they have a cut off of blood supply to the heart. Sometimes atherosclerosis can also cause it, which is called rupture of the blood vessels. When the bad cholesterol keep on packing with the mineral, with all the destiny in the body, keep on increasing, it makes that place to occlude. Occlude means blockage, like when gutter is blocked, then it will rise. It will start rising. It will start growing so big to the extent that it can rupture. It can break. When it breaks, the blood supply will now start pouring inside the body instead of following the right channel. This is what is called atherosclerosis. You understand? The rupture of the blood vessels. If you rupture, the blood cannot flow again. It will bring about the death of the muscles of the heart. Also, another thing that can cause this heart attack we are talking about, is when you have blood clots. When suddenly the blood that is flowing normal, suddenly something have a blockage and it become what is called thrombosis. It became like a stone. For women that normally see their menstrual cycle, you see sometimes you have blood clots. Blood clots can happen even in the blood vessels, and this one can bring occlusion. It can bring blockage to the supply of the blood to the muscles of the heart. And what will happen? The heart will have an issue. Something like smoking can cause a problem to the heart. Something like high cholesterol, something like hypertension, something like diabetes, something like high cholesterol, a lot of things that can bring about the cutoff of blood supply to the muscles of the heart. And all these things I've mentioned, all of them is something that we can be taking care of. Then if you're overweight, like me, I was overweight. I'm working on my weight right now. For some of you that follow me from time to time, you find out that I am really losing my weight. I'm really working on it. It's so hard, I know, but for the health, I have to do it. Because when you're overweight, you are so prone to obesity. You are so prone to a lot of health conditions. Like diabetes also has an effect on the heart, on our heart. And when you have all these sicknesses, when you have severe stress, like us women, we work ourselves so bad. Excessive stress can affect our heart muscles. Anything that can affect the heart muscles not to pump, not to have blood supply, can affect our heart. You understand? So people that consume too much alcohol, we have to be very careful, because all these things causes obesity. Obesity causes problem, cholesterol, plaque. It causes a very big fat to block the blood vessels, and narrowing of the blood vessels also can cause it. You understand? So all these things, you have to be very, very careful. We should check regularly. So these are the causes I have mentioned now. Now I am heading to signs and symptoms. How can somebody know that he or she is about to have heart attack? You know, because of the way the heart attack normally appear, it's always mimic digestive problem. It's always mimic indigestion, or maybe somebody that have heartburn. But if you pay attention to it, more especially when you're having a severe chest pain and the pain is radiating to your left shoulder towards the back, there is a condition called angina pectoris. Angina pectoris is another condition altogether. I may treat it next time, but for now I'm talking about heart attack. The heart attack, when you see the pain is always like a tightening in the chest, and this tightening will extend to the left shoulder, towards the back of the left shoulder. The person will now have to think, what is going on with me? Anxiety and everything will set in. But don't panic, relax. And you have to calculate, check, how often does it happen? And if the pain or if the tightening is coming towards your jaw, you have to watch it. If it's coming to the back of the hand, which is angina, watch it. If you're having shortness of breath, you're feeling like you are not breathing, you're feeling like you want to vomit, you're feeling like you're fainting, and suddenly you started sweating excessively, a cold sweat, not that a sweat that you feel that you are feeling hot, but suddenly you have a cold sweat, please, the person have to rush to emergency room and to check immediately, if possible. But if it happened that it have already occurred, it have already happened, because it happened to some people, irrespective of whether male or female, whether young or old, it happens to everybody. Before, we normally say that heart attack is the sickness of the old people. No, it's no longer like that, because of the junk food you are eating now. The cholesterol level is too high. The plaque, everything is, the whole health system is scattered. So everybody have to be on a watch out. Don't take it as because I normally have heartburn, then you're having tightening of the heart, of the chest, you don't look at it. And when you're having this tightening of the chest, you're having a pain that radiating to the back of the hand, pain radiating to your jaw, and suddenly you feel like you want to vomit, you're feeling fainty, please, if you still have time, call anybody around. They should take you to emergency room. But if all these things happen and nobody was around you and the person has gone down, then anybody that see them, please, immediately they should start CPR. They should start doing CPR. That's pressing of the chest. For people who don't know what is CPR, pressing of the chest. You understand? Start pressing. Press it like, I think 32 compression. Then you give mouth breath. You give oxygen through your mouth until the emergency responders will be able to arrive, or before they will take the person to the hospital. Then if it happens and there is anybody around that place when it happened that have aspirin, please, aspirin, they should give 300 milligram immediately. And when they are sending the person to the emergency room, they should notify the doctor that aspirin 300 milligram has been given. Not keeping the person on the floor and be shouting and be pouring water and all. It will never help. CPR is the only option that will make the brain to retain its oxygen until the person will arrive to a place where he can take a proper medical assistance. You understand me? So if they can be able to get aspirin and give to the person, it will be fine. Then transfer the person to the hospital. When they reach to the hospital management will now take over and start doing the other medications and everything that they're supposed to give to the person. I'm sorry, this video is a little bit long, more than what I prepared. So when they have done all these things, hand it over to the hospital, everything. But hospital will now take over. They know what to do there. But what is my major concern is from home, where it happened, and to the environment when they find the person and transferring of the person to the medical facility. This is my major concern, because I know when they reach to hospital facility, they know what to do. So this is what I'm telling you now. How can we prevent? What is this? How can we prevent this heart attack? We can prevent it in many ways. First of all, check If it's not genetic issue or family history, if it's not hereditary, the person did not get it from the family, that one is something else. But if it's generally that the person just suddenly developed it, maybe because of dietary problem, please, you should watch your dietary. Watch what you're eating. Watch amount of cholesterol you put in the body. Watch amount of things you eat that you're not supposed to eat. A lot of food that is not supposed you to eat, for somebody who have developed heart problem and you're still consuming them, it will trigger it, and somebody can have heart attack like twice if the person is lucky. Another one, if you overweight, please work on your weight because of this cholesterol we are talking about. Then if the person is smoking, please watch it. Watch it. Go to hospital checkups regularly. If the person is taking excessive alcohol, please watch it. If the person is doing chronic stress, like the people that walk themselves off like as if they are their fan belt, as if they are their machine, please watch it. Excessive stress kills. It kills the muscles of the heart. It causes a lot of medical issues. Then if what am I forgetting? If you have high blood pressure, please put it on check. Let your high blood pressure be on check. If you have diabetes, please put it on check, because the amount of sugar in your body, let it not overweigh your organs and let it not cause more damages to you. If you have diabetes, check it. If you have hypertension, check it. If you're overweight, check it. If you have high cholesterol, check it. So all these things I'm saying, then in all, please, we should endeavor to always make time to go and meet a cardiologist, somebody who is a specialist for the heart. A specialist doctor for the heart is a cardiologist. And please, for those of you who are picking people on the way from their car, from anywhere that they have heart attack, please make sure that the facility you are taking the person is a facility that have the equipment, that have the departments of cardiology in them, not like a regular clinic. You cannot pick somebody who has a heart attack and send the person to a regular clinic. Please, it should be sent to a medical facility, to a hospital that have the medical facility needed for this particular person. And on the way, they should take care of it. And in this avenue, please, I am pleading with my people. Paramedics is very, very important in every society. In Israel here, where we are, I belong to a group called the paramedic group, and here we are many. They have Magen David, they have our own. We have our own, which is called Hatala, and other ambulance services. It is very, very important. Paramedics are super important, more than having hospitals. Please, if there is people who will volunteer to work on this, the government, please, I'm pleading with you people. If you people can be able to work on it, to provide these amenities, individuals, you can work on this and provide. We are working like volunteers. Nobody is paying us. It's from our heart to save life, because we believe in 1 minute to save life and 1 minute to lose a life. Remember, when you're losing a life, it doesn't ask about gender, race, color, anything. Please, the government or individuals, we should work hard to make sure that we have paramedics around us, every street, every corner. As long as there's people living there, we're supposed to have paramedics in every single street. In case if anybody is called, somebody is having heart attack, somebody can be able to quickly run out and save the person. And we should form a medical information center. I don't know if we have it in Nigeria, because I've been away for a long time. If they have a medical information center, they can quickly call and say somebody collapsed so place, and I think there's a need for the person to be attended, and they will call people around, because their phone numbers will be there in that line, and they'll be able to meet up in time. Then instead of us losing our able-bodied young men and women in the hands of heart attack because of something somebody can just do a little magic and the person will recover and they will send the person to the hospital. Thank you so much. Happy Heart World Day. Happy World Heart Day. Anyhow it is, English is not my language, but I believe you guys understand what I say. Thank you so much. Love you guys. Thank you.